Okay, let's unpack this. Today, we're exploring an area, well, it seems brimming with potential for business owners like you.
Mm-hmm.
We're talking about the healthcare and life sciences sector, specifically in Northwest Alberta.
Right, the Grand Prairie Greenview corridor. It's really emerging.
Exactly. And our mission here, really, is to cut through the data from this sector profile. We want to pull out the key insights for you.
Like a shortcut to understanding the opportunities.
Spot on.
Yeah.
And we've got solid sources backing this up. Work NW Alberta, for instance.
And manifold data mining, Lightcast analyst, IBIS World 2. Incredible stuff.
Definitely grounded in hard data, not just guesswork.
And what's really fascinating here, I think, especially for you as a business owner, is that this isn't just about hospitals or clinics in isolation.
Right, it's bigger than that.
Much bigger. We're looking at a whole ecosystem. It has broad implications, potential for many kinds of businesses, not just, strictly medical ones. So when the report mentions the region, it's talking about a pretty significant area. The city of Grande Prairie, the county of Grande Prairie, the MD of Greenview, which is, well, it's a large administrative area covering rural and industrial development, plus surrounding towns, First Nations communities.
So it's quite expansive.
Oh, yeah. Nearly 40,000 square kilometers. It's basically the gateway, the resource hub for Northwestern Alberta.
With Grande Prairie City as the main center.
Exactly. Understanding that scale is, I think, key to seeing the opportunity here.
That context, that scale, it really makes the next numbers quite compelling. The projections show, a massive need for skilled people in the Invest Northwest Alberta region.
Yeah, that's the strategic area for growth, yeah.
By 2031, we're talking over 4,000 skilled employees needed across key sectors. And healthcare is a big slice of that pie.
It really is. This region is often called a northern economic powerhouse.
Serving a trade market of, 300,000 people?
Around that, yes. So if you're a business owner listening, think of that 300,000. That's your potential extended client base.
Okay, so zooming into healthcare and life sciences specifically. In 2024, the numbers are 2,407 people employed across 242 businesses.
Right. But here's a key detail for business owners.
What's that?
The majority are small enterprises. Think about this. 35%, over a third, employ fewer than 4 people.
Wow, okay, so that suggests what?
Accessibility.
Accessibility, absolutely. And potential. Imagine the need for specialized services, accounting, IT, marketing, maybe even equipment repair targeted at these smaller, growing operations.
So you don't need to be a giant corporation to get involved.
Not at all. Being agile, focused, that could actually be a big advantage here. You can really support these numerous small players.
That makes sense.
And underpinning all this is a growing and concentrated population, plus a pretty robust workforce.
Okay, tell me about the demographics.
So the region's population is about 138,847 now in 2024, projected to hit over 145,000 by 2031.
So steady growth. Steady growth. And here's a crucial point for planning. About 60% of these people live in the city of Grande Prairie.
Right.
And just as important, 60% of the working age population is also right there.
So your workforce, your main clients, they're highly localized.
Exactly. Easier to target your efforts. And age-wise, 43% are in that prime working bracket, 25 to 54. A strong labor pool.
And education.
It's diverse. About a third have high school, 20% college, 18% university cert or degree. Labor force participation is healthy, around 74%.
Okay.
But here's something really relevant. One of the top fields of study for residents is health and related fields.
So there's already a base of trained people.
A significant base. Over 6,800 individuals with that background. It's not just a number, it means a pre-existing talent pool. Less recruitment headache, potentially.
That talent base is critical, especially when you look at what's driving demand within the sector.
Right.
So let's define it. What exactly falls under healthcare and life sciences here?
It's pretty broad, actually. Covers diagnosis, treatment, sure, but also residential care, social assistance, and even manufacturing things like pharmaceuticals or medical supplies.
So lots of different angles for businesses.
Definitely. And the growth projection. It's solid. Employment's expected to climb by 233 jobs. That's a 10% increase, reaching 2,640 positions by 2031.
Okay, 10% growth overall, but where's the fastest expansion?
Good question. The data points to a few subsectors. Offices of dentists, they're looking at a 25% jump, about 140 new jobs.
Wow, yeah.
Then other ambulatory healthcare services, think ambulance services, blood banks, Specialized clinics, maybe, that's pegged at 21% growth, 21 new jobs.
Small number, but high percentage growth.
Exactly. And outpatient care centers are projected for 19% growth, adding 53 jobs. These are clear areas where demand is pushing growth.
Makes sense. And the overall future outlook seems quite positive.
Overwhelmingly so.
Yeah.
Several key drivers. First, obviously, the growing regional population means more demand for services. Simple math. Second, there's a real strategic push to attract and keep healthcare professionals. They know they need the staff.
And third,
A strong ambition, really, for the region to become the main hub for health services in all of Northwestern Alberta.
is that just talk or is there action behind it?
Oh, there's concrete action. The big one is the new Prairie Regional Hospital, opened in 2021.
Ah, yes, that was a major project.
Huge. It's not just a building, it's transformed access to specialized care. It's a magnet drawing patients and professionals.
And there are national factors too, right?
Absolutely. Canada's public healthcare system ensures access. Then you've got the demographic shift, the growing 65-plus population needing more care, and technology, of course. Things like telemedicine keep changing how services are delivered.
Okay.
Which brings us really to the core question for you, the business owner listening. Where do you fit? What are the specific targets?
Right, the opportunities.
The report flags key suppliers to the sector. This is prime B2B territory. Think medical instruments, supply manufacturing, pharma manufacturing, testing labs, even engineering services for the facilities. These are essential support businesses.
Often overlooked, maybe.
Very possibly. And on the flip side, the key buyers are mainly hospitals and doctors' offices. Those are your larger potential clients if you're selling into the sector.
Okay, suppliers and buyers. What about workforce costs? Wages.
Crucial info. Average wages give you a benchmark. Registered nurses, for example, average around $86,600.
Okay.
Dental hygienists are quite high, averaging over $118,500. Nurse aides are around $47,200, and receptionists about $54,250.
So knowing that helps budget for hiring.
Exactly. And it also shows it's a competitive market for talent. You'll need good compensation, a good work environment.
What does recent hiring look like? Any data on that?
Yes. The job posting data from 2024, January to December, showed 618 unique postings in the sector.
That sounds active.
It is. The median advertised salary was $66,300. And interestingly, 26%, over a quarter, offered salaries above $93,000.
So strong competition for certain roles.
Definitely indicates active, competitive hiring. The top postings were for nurse aides, RNs, and social and community service workers. Shows where the immediate needs are.
That's fascinating. So clear opportunities, both direct and indirect. But what about support? Is there help for businesses wanting to enter or grow here?
Yes, and that's another strength of the region. There's a robust support ecosystem.
Like what?
Well, for innovation, there's the Prairie Regional Innovation Network, gprin.ca. Great for entrepreneurs with new ideas.
Okay.
For general business support, Startup Through Growth, Community Futures, Grande Prairie and Region is a key resource. That's grandeprairie.albertakif.com.
Got it.
And the ATB Entrepreneur Center offers networking, workshops. These are active local groups ready to help.
Good to know those exist. But what about training the workforce itself? You mentioned the existing talent, but future growth.
That's maybe one of the most exciting parts, really underlines the long-term commitment. Northwestern Polytechnic, NWP, is central.
They have health programs already.
Oh, yes. BSc in nursing, practical nurse diplomas, healthcare aid certificates, feeding that pipeline directly.
Okay.
But here's the real game changer. The new Northern Alberta Medical Program. It's a partnership with the University of Alberta.
Right, bringing medical students to Grande Prairie.
Exactly. First cohort starts fall 2025. They'll train at NWP and in the state-of-the-art health education center inside the new hospital.
Wow, that's a huge investment in local talent.
Massive. It signals a deep commitment to building that healthcare future right there. Ensures a steady supply of professionals.
And are there other training partners involved too?
There are Rupert's Land Institute for Metis Support and Job Matching, Western Cree Tribal Council for Indigenous Skills Training, Careers, the Next Generation for youth, and Northern Lakes College offers distance learning, including health programs. It's a really comprehensive network.
Okay, so pulling all these threads together,
Yeah.
What's the big picture takeaway for a business owner?
The big picture is this. Northwest Alberta isn't just growing by chance. It's making strategic, deliberate investments in health and life sciences.
Creating a specific kind of environment.
Exactly. A dynamic, forward-looking environment for businesses in or supporting the sector. The recap is growing population, focused workforce development, major infrastructure investment.
Like the hospital and the training center.
Precisely. It all adds up to tangible potential if you're looking to start, expand, or even pivot your business to meet these growing needs.
So really consider how your business fits or could fit.
Yes. How can you serve this hub? How can you leverage the support systems available? Explore those angles.
Okay, so what does this all mean for your next move if you're listening to this? Don't just think narrowly about direct healthcare. Think bigger. Given this huge investment in local medical training, meaning more doctors, more nurses, right there in Grand Prairie.
The steady stream.
And the reality of an aging population needing more care. What innovative services could you develop now? What support systems are needed for the next decade?
Good question.
Are we talking digital health? Connecting patients remotely? Virtual consults? Maybe specialized logistics for medical supplies in the north?
Lots of possibilities beyond the obvious.
Exactly. The opportunity isn't just in healthcare, it's in the whole ecosystem around it.
Yeah.
So the final thought is, how can your business contribute to and benefit from making a great living and living a great life in this really booming part of Alberta?